March. Not the cost.
Oh, you know what it is?
Cost of taking a. But Medicare can't say that. I have said. Good. All right, ladies and gentlemen, good afternoon.
I'll tell you.
This is the June 8, 2023 meeting of the West Side Council of Governments. And we can go around the room as people tell us their name and the city they represent and whether or not they're a voting member. So start over there.
Hello, everyone. My name is Jeff Cow, representing the City of Los Angeles, Office of Councilwoman Tracy Park.
Hello, name is Austin Sear, serving as Supervisor Lindsay Horvath's alternate.
Göran Eriksson, council member, City of Culver City, voting delegate.
Thank you. I'm Julian Gold, Mayor of the City of Beverly Hills, the voting delegate.
Winnie Fong with the West Side Cities Council of Governments.
There we go. Lauren Langer, counsel for the COG.
Seppi Shine, representative for the City of West Hollywood. Oscar de la Torre, voting delegate for the city of Santa Monica.
Jesse Zwick, alternate for the city of Santa Monica.
Great.
Gabriella Yap, Senior Policy Management Administrator for the City of Beverly Hills.
Shelley Wolfberg, Assistant to the City Manager, City of Culver City.
Anuj Gupta, Deputy City Manager, City of Santa Monica.
Adnan Molina, City of West Hollywood.
Riley O'Brien, West Side City SCOG.
Okay, and on our Zoom, Troy, please introduce yourself. That's Les Friedman. Troy? I see Vice Mayor Lester Friedman.
Yeah, Lester Friedman, alternate City of Beverly Hills.
Thank you. I see our Executive Director there, Cecilia. Say hi.
Cecilia Estelano, Executive Director.
Diana?
This is Diana, Chief Transportation Officer with the City of Culver City.
Thank you. Jake?
Jake Ettinger with Senator Ben Allen.
Thank you, sir. Jason?
Good afternoon, Jason Klieger, Mobility Manager for the City of Santa Monica.
Thank you. Troy, one more time. Okay. Is there anybody who I have not recognized? Okay. So with that, we're going to move on to our action items. The first is the meeting notes from April 20. Anybody want to adjust those in any way? If not, I'll entertain a motion to approve.
So moved. Second.
Thank you. Roll call.
Beverly Hills,
Yes.
Culver City,
Aye.
Santa Monica,
Yes.
West Hollywood,
Aye.
and County of Los Angeles.
Yes.
Great. Thank you. Motion passes. We're going to move on to item B, 2B, Measure M, multi-year sub-regional program. The annual update. I'm going to turn this over to you.
Yes, this is the time of the year to approve our annual updates to the multi-year sub-regional program for Measure M. We have a presenter here, John from Fear and Peers, in a presentation. So John, we'll turn it over to you.
Okay, thanks, Winnie. Good afternoon, everybody. I'm John Mugridge with Fair and Pearce Transportation Consultants, and we've been retained by the West Side Cities COG to help with the annual updates to the MSP program, Metro Sub-Regional Program. Next slide.
Sorry, just one moment. Sharing the slide itself. There we go.
And as we're putting up the slides, I just want to point out that this has the potential to be a long agenda. So I'm going to try and move people along. But if you're tight for time towards the end, feel free to go. But we may extend beyond the 1:15 timeframe. Sorry for that.
Thank you.
That was a subtle way of saying be brave.
Next slide, please.
All right.
So today we're going to talk about a number of different items. We're going to cover the original adoption of the project list in 2021, along with the update that's happened subsequent to that. Have some discussion on funding allocation, the actual projects, and then we're going to end up talking about what's happening in 2023, what's in front of you today for adoption, the changes and revisions to the project list. And we'll finish talking about the timeline and next steps in terms of the board approval, what happens after that, when it goes to Metro, how long they're going to take for their approval, and ultimately when it ends up at the Metro board. Next slide. Okay, so going back to 2021, when this project was originally formed, we were sort of engaged to help the COG figure out how to allocate the funding to the subregion. And we looked at many different things, many different metrics, including transit boardings, transit alightings, collision data, pedestrian and bicycle data, multiple different metrics, and ultimately settled on what we call service population, which is the sum of population and jobs in the subregion, and use that to allocate the funding across the subregion and the different jurisdictions. So back in 21, there was $27.3 million available for the subregion. That was all programmed, or pretty much all programmed. $26.1 million was programmed in 2021. The county was the only agency that didn't program any funds that year. Subsequent to that, there were some adjustments to the program in terms of the support function. Some more money came in from Metro, $8.5 million, which led to more funding being programmed in 2022. The only agency in 22 to program funding was out of Santa Monica. Following that, there was some more money available, $4.5 million, and that brings us to today where there's basically $13.1 million available for the sub-region. Next slide. So this is the project list that was adopted in 21. I'm not going to go through all of them, but just highlight a couple of things. You might notice that most of the projects are active transportation projects, first, last mile type projects. And that was because back when Measure M was developed, that was what the COG wanted to have funded. In terms of notable projects here, the Washington Transit Mobility Lanes and Circulator project has been completed. So that's great news. All the other projects are currently moving along. As I mentioned on the first slide, LA County decided to roll their funding across to subsequent years when they will find a project to basically put on the list. Next slide. So fast forward to 2022, the projects that are in italics here have had some changes to them. It's basically related to the funding allocation, the year of funding. So that's really just a small administrative change. Beverly Hills, they rolled their projects together. They basically absorbed the two projects into the La Cienega Purple Lane Extension First Last Mile project. City of Santa Monica added some funding to their Wilshire Ped Safety project. And again, the county decided to hold their funds for future years. Next slide. So here we are today in 2023. We have $13.1 million available across the subregion. That's going to be allocated by the methodology I described earlier, the service population methodology. And what's notable about this year is that there are 3 agencies that are actually going to hold their funding for future projects: Santa Monica, Los Angeles, and the county, while West Hollywood, Culver City, and Beverly Hills are proceeding with allocating that funding to new projects. For example, the Sepulveda Corridor Mobility Lane project in Culver City. One thing I just want to mention here is that there will be some new data available later this year for the service population information. So the allocations, when you see this again next year, the allocations may change from what they are right now. Next slide. This is all the changes that are in front of you today to the project list in 2023. Those that are highlighted in bold are actual changes, and where there is no bold, those projects are essentially staying the same as they are in 2022. For example, the City of Los Angeles is modifying their program year for the Expo Bike Path and the Connect Del Rey project, while Culver City, as I mentioned previously, is going to have a new project and is allocating all their funding in 23. And finally, next slide, in terms of the timeline, we're here for approval today. If that goes smoothly, the project list will then head to the Metro board, Metro staff for review, which will take approximately 60 days. It could be sooner than that, but perhaps I don't think it'll be longer. And finally, it will go in front of the Metro board programming and planning committee in October 18th and ending up at the board at October 26th. So that concludes my presentation this afternoon. I'm available for any questions.
Thank you, sir. I understand we have a public comment before we take, sir? 2 minutes. 2 minutes, sir.
Good afternoon. I'm Kevin Burton. I'm a resident of West Hollywood and an avid pedestrian and bicyclist. I want to thank the COG for programming funding from Measure M for active transportation projects. And specifically, I want to support West Hollywood's allocation of its funding for the upcoming protected bike lanes and sidewalk widening on Fountain Avenue. That's a very important project for our city. It's not far from where you're meeting today, and I took that route on my bike to come to the meeting. Also, I'm pleased to see the City of Beverly Hills is programming funding for first last mile access to its upcoming subway stations. I spoke about that a few years ago at this meeting, how Beverly Hills should prepare, and I'm pleased to see that they have done so. Thank you to the COG for its ongoing support region-wide for active transportation.
Thank you, sir. Was there any other public comment? We have public comment online?
Riley?
No. No? Okay. Yes, sir.
Yeah. Quick question. This is all capital funding, not for sort of any type of security or social service programs. And mainly my question is around end of the line protocols and practices. And there's some concerns in our city in Santa Monica in terms of how we might be able to address some safety concerns at the last stop. So I just wanted to know, is there any way that we can allocate funding, or the money that's allocated to our city can it be used for those purposes, or is it just strictly capital?
I don't believe it can be used for those purposes, but that's something that maybe Winnie can weigh in on as well.
Yeah.
Is this only capital money, or can it be used for operating costs?
This is for capital projects, not O&M.
Yeah.
Okay, thank you. Thank you, Cecilia.
Okay, thanks.
Okay. Are there any other questions in this auditorium? Are there any questions online? Okay, seeing none, thank you, sir. Appreciate the report. Let's move on to item C. Oh, we need to vote on it. Okay.
So I move adoption.
Move adoption. Is there a second?
Second.
Okay, roll call.
Beverly Hills,
Yes.
Gulf City,
Aye.
Santa Monica,
Yes.
West Hollywood,
Aye.
and the county.
Abstain.
Great. Okay, thank you. Glad we voted. This is item C, the Metro Deputy Contract Extension for the Southwest Area Metro Board member. You gonna do this?
Yeah, this is going to be very quick. Our COG is represented by the Metro Southwest Corridor along with South Bay cities. Over the past few decades or a decade, we've been contracting with Michael Bulkey as a Metro Deputy to our Metro Board member, Mayor James Butts of Inglewood. His contract expires, so we're asking for the board to approve another 3-year contract extension. In terms of fiscal impact, our contribution to his salary remains the same at $1,832.
Great. Okay. Public comment on that? Any questions on that? I'll entertain a motion to accept that.
So moved.
For second?
Second.
Roll call?
Beverly Hills,
Yes.
Culver City,
Aye.
Santa Monica,
Yes.
West Hollywood,
Aye.
and the county.
Yes.
Thank you. On to item D. This is a request for regionally equitable distribution of any accelerated Measure M sub-regional equity partner, SEP. I'm going to turn that to you.
Yes, I will actually turn this over to City of West Hollywood staff. I believe David Fenn, you'll be speaking and presenting this.
Yes. Good afternoon, everyone. David Fenn, Senior Planner in the Long Range Planning Division here at the City of West Hollywood. The item before you is a suggestion for the COG to send a letter to Metro for a regionally equitable distribution of sub-regional equity funds, which there have been.
Can you speak up a little bit more into the mic? I'm having trouble hearing you on this side.
Sure. So the item before you is a suggestion for the COG to send a letter to Metro asking for a regionally equitable distribution of sub-regional equity funds. There have been requests from other subregions to accelerate their funding in this program. And our concern is that if the COG doesn't submit a request for these funds, that the avenues available to the other subregions may not be available to us. So in your packet is a draft letter, which we've requested that the COG might consider. We circulated this with each of the other cities through the Transportation Working Group. And the goal is to ensure that the West Side is included if Metro finds a way to make those sub-regional equity funds available sooner for the other subregions. This is funding that was given to each of the subregions to make them whole after funding was made available for the San Fernando Valley COG for an additional project that was added to Measure M. So it's kind of within the original intent of the program to make sure that it continues to be distributed equitably between the subregions.
Okay, done?
Yeah.
Yep. Mayor Shine, do you want to add to that? Or?
Yeah, I think it's important, given in the past, the Metro has not always distributed sub-funding equitably. So to be proactive and send this letter And so they know where we stand is a way to prevent any past inequity from happening.
Okay. Thank you. Thank you. Is there anybody in the audience that wants to address this? Okay, any questions from the panel here?
No, just a move approval.
Second.
We have a motion. Was there a second?
Second.
Okay. Just to be clear, is there any conversation, any discussion coming from the video? Zoom? Anybody? No? Okay. And nobody here? Okay. Roll call?
Beverly Hills,
Yes.
Culver City,
Aye.
Santa Monica,
Yes.
West Hollywood,
Aye.
and the county.
Yes.
Well, we just made up some time. All right. We're on to item E. This is Measure H, City Planning Grant Remaining Funds. 2 minutes.
Yeah, this will be also be very quick. So the County Homeless Initiative also provides city planning grants to individual jurisdictions under Measure H. The contracts for both Culver City and West Hollywood, their contracts ended on December 31st of 2022. So the county is proposing that we allocate those unspent funds to the COG's existing homelessness contract. And our proposal is to earmark those funds back to the city for the purpose of Culver City's motel voucher program, as well as to support West Hollywood's Holloway interim housing project.
Okay. And for clarity, these were dollars that were earmarked for them in the first place.
Correct.
Okay. All right. Councilmember Erickson, any comments?
Not really. It's needed. We are gonna pass a budget here in a few days with a close to $13 million deficit spending, and most of that money goes into our different project for homelessness. So this helps to be able to keep this money.
Yes, sir. Mayor Shine, any thoughts?
Yes, no, thank you. I think it's great. And, we intend to use the funds to continue with the development of the Holloway project, which is really important. So.
Thank you. Any public comment on this? Anybody else in the auditorium or on Zoom want to make a comment? I'll entertain a motion.
So moved.
Second.
Roll call?
Beverly Hills,
Yes.
Culver City,
Aye.
Santa Monica,
Yes.
West Hollywood,
Aye.
and the county.
Yes.
Great. Motion passes. Okay, we're moving on to the fiscal actions for our next fiscal year, 23-24. Winnie?
Yes, this is a multiple action under our fiscal actions. The first one is to determine the dues and annual budget, which supports the annual work plan, as well as Solana Advisors contract renewal to continue serving as the West Side City's COG executive director. I'll start with the determination of dues. We would like, according to our bylaws, we need to determine the dues 60 days in advance of when the dues are assessed. We had not been able to do that, so we would like to request that the COG board waive that. The dues remain the same for this upcoming fiscal year in 2024. However, we would like the board to consider increasing the dues because it's been about 8 years since we have done so. And the annual budget reflects the current dues, as well as Solano Advisors monthly retainer fee remains the same as well. The budget also reflects all of the incoming grant funding from the county Measure H, Measure M, and SCAG REAP funds. That's our update under the fiscal actions. If anyone has questions for the staff.
Is that all of these? Okay. Public comment? Comment from anybody here? No? Anybody on Zoom?
Thank you.
Okay, I'll entertain a motion to accept.
So moved.
Second.
Roll call, please.
Beverly Hills,
Yes.
Culver City,
Aye.
Santa Monica,
Yes.
West Hollywood.
Aye.
And county.
Yes.
Does that get us all the way down to G?
Yes. Wait.
Was that all 3 items?
Mhm. Oh,
Okay, yeah, so I actually, for part 3, I need to recuse myself due to a campaign contribution to my congressional campaign.
okay,
Okay, we'll let the record reflect the recusal,
okay.
Thank you.
right?
Did you second? It was
We're up.
Oscar.
I'm sorry?
Oh, no, I was just wondering who.
Okay.
All right. Thank you.
All right, so we're up to item G. The election of the West Side COG board officers for our next year, 23-24. It was a pretty quick year. I'm gonna hand you the gavel. Be careful with it. All right, so I nominate Jorn Erickson as the next chair of the COG. Is there a second? No?
Second.
Second.
Oh. Roll, are we gonna do them all at once? Vote on them all?
All at once.
All at once. Okay,
Well, thank you. And I would like to nominate Oscar De La Torre from the city of Santa Monica as vice president.
great. Great. You now have a speaking part.
Yes, okay, so I would like to nominate Seppi
Shine, like shine
Shine.
bright like a diamond.
Shine from West Hollywood for the role of secretary.
Okay, great. And you accept that role.
Yes, I do. Thank you.
Okay. Roll call?
Can we go back to who moved the motion?
I moved the motion.
Moved the motion and then you second. Okay. All right, let's do roll call. Beverly Hills,
Yes.
Culver City,
Aye.
Santa Monica,
Yes.
West Hollywood.
Aye.
And the county.
Yes.
Okay, we're up to the executive director report. Are you gonna give this or is Cecilia? Are you still with us, Cecilia?
I'm still here, but I think Winnie should give it. I'm just watching.
Thank you. Looks like you're moving.
She's in the car.
Yeah, I'm in downtown on the freeway right now.
Okay.
Okay, I'll be very brief with my updates on behalf of the executive director. Our upcoming board appointments, we are opening the call for candidates for our representative for the Santa Monica Bay Restoration Commission. This is for another 2-year term. Our current representative is Vice Mayor Yasmin Imani McMorrin. Her term is up in the end of August, I believe. The representative has an opportunity to also appoint 2 representatives. So we are accepting letters of interest by June 30th of, or July 30th of next month. We have also our recent activities from our staff on.
Before you do that, what are the requirements to serve? You need to be elected
Yes, elected.
and presumably your term has to extend beyond the 2 years, at least the 2 years.
Yes, that's correct.
Okay, and anybody else can appoint themselves or recommend themselves or be recommended,
Yes, we're asking for them to submit a letter of interest.
self-nominate. Okay. And how are we going to communicate that to our individual council
I will send that to the city clerks to submit
to
to the city
distribute?
council.
Fantastic. Thank you.
All right. In terms of housing updates, we are extending the deadline to submit our scope of work for the Regional Early Action Plan REAP 2.0. As stated in the packet, we would like to use the funds. We'll be drafting the scope of works to continue the work on exploring establishing a regional housing trust, as well as provide on-call technical assistance to support city in implementing their housing elements. Also in the packet, I'd like to call your attention to the SCAG Housing Needs Assessment RENA reform. Each CD is currently doing its outreach on accepting feedback and input from stakeholders on the reform. SCAG is doing their own outreach and has provided a draft recommendations, which is in their packet. They also have a feedback survey to be completed by the end of June. So we encourage city staff in jurisdiction to review the draft recommendations and provide their comments via the survey.
Great.
And then lastly, the transportation updates, logistical contracts with the Measure M multi-sub-regional program. We have a contract with Fear and Peers under SCAG's contract, which covered both the mobility study and the development of the MSP process. That contract ends end of this year. We would like to continue working with Fear and Peers to manage the annual updates by entering a direct contract agreement. So we'll be working with our legal counsel to present that in our August meeting.
Okay.
And that's it for our updates.
Any public comment on any of that? Any comments from the COG? Or on Zoom? Anybody? No? Okay, let's move along. We're gonna just change the order of 5 and 6. I promised Mr. Kiernan that. So Jeff, it's great to see you as always.
Good afternoon, everyone. Jeff Kiernan with the League of California Cities. I have submitted a packet of information to you in your board packet. And actually the QR code on that sheet has updated information on the bill locations. If you are interested in that or have any specific questions, I do want to highlight one piece of legislation, SB 423 by Senator Wiener. Cal Cities is opposed to that piece of legislation, and that bill is now moved over to the Assembly. But I would encourage all the board members to thank Senator Allen for his no vote on that bill. Elsewhere, I did want to make reference to the handout I've brought with me today, the brightly colored orange handout. Hopefully that can get to those folks on Zoom via the electronic code as well. Just to highlight now, AB 1657, Cal Cities is supporting this. These are all going to be housing bills. The Cal Cities is supporting this $10 billion housing bond. We are certainly interested in more affordable housing dollars coming from the state. Quickly, AB 309 by Assemblymember Lee, that's the social housing bill. It would allow the state to bypass their own and all local regulations related to zoning, should they decide to get into the business of creating housing on their own via a new agency. We are opposed to that bill. We are seeking amendments to that bill that would cause us to go neutral on it should they decide to comply with local zoning regulations. Correct. And then there is one other one that is sort of adjacent to housing. That is the SB 584, the bill that would create a 15% TOT tax on short-term rentals. This would be on top of any local TOT that is applied, which is currently on average about 10% across the state, making it near 25% in most jurisdictions. We also object to not only the height of that tax, but also the fact that those funds would go to the state rather than staying locally. So those are just a few things that I wanted to highlight. Lastly, I also just did want to highlight, if you're planning on attending our annual conference this coming September, housing is going extremely quickly. The Sheraton and the Hyatt are already fully booked out for at least the discounted room blocks. You can still find a couple fully priced or additionally priced rooms at the Hyatt. Last I checked yesterday morning, but those housing rooms are going very quickly. So I would encourage board members who are planning to attend to book as soon as possible if you want to get a close hotel. So that's all I have, but happy to answer any questions if you have them.
Anybody have any questions for Jeff? Go ahead.
That's my understanding that Senator Allen abstained. Is that?
He
voted
did,
no.
correct. I shouldn't have said no vote. He did abstain from
abstained.
voting.
Okay, thank you. I would just say that SB 35 has led to the creation of a lot of affordable housing across the state. And I think we should support SB 423 in order to continue that.
Okay, thank you, sir.
Thank you.
Okay, anybody else like to have a comment, ask a question, whatever? No? Zoom, anybody? Great. Well, so then we move to Mr. Corbett. And you are a principal of Initium Health. And after that, I'm going to let you tell us all about you and all about what you do. So thank you for being here.
Thank you.
Yes, and I come here from Denver, Colorado. I've been hired on behalf of the city of Santa Monica to do a behavioral health feasibility study. So today I'll speak about that feasibility study. I'll also talk about national best practices in this space that might be useful as you move forward in your work. You can go to the next slide. So today I've just really covered the topics of what we're doing in Santa Monica, some national best practices, and we'll open it up for Q&A. Go to the next slide, please. So as a start, our firm is a public benefit company, so it is aligned, I think, with the mission of a lot of counties across the country. We're currently in 10 states working in areas related to this space, from statewide campaigns in New Hampshire to feasibility studies in places like Palm Beach County, Eastern New Mexico, and other states across the country. And what we learned in this work is that I'm a former hospital administrator, I should say. I have both a law degree and a master of divinity, so I'm an ethicist. I've often worked in Catholic hospitals with that degree on the divinity side and worked in both for-profit and not-for-profit systems. So I think I have an inside look at kind of the challenges for health systems to expand their behavioral health role. And what I'm seeing across the country in an era where the number of psych beds are been diminished is we're seeing a lot of states and counties step into that space. The challenges for hospitals of running psych facilities are that when it's attached to the hospital, all those patients often end up in the hospital's emergency room. And because there's a shortage of beds nationally and in California, people will drive from far distances to go to that hospital emergency room. And what happens is you'll have an inordinate amount of folks suffering from mental health and substance use issues in that ER. And people will leave that ER with kids and other issues and go to another emergency room. So hospitals for a long time have been resistant to expand into that space, not to mention that regrettably they're paid more to work on things such as orthopedics and neurology. So hospitals move to that space, recognizing it's a business, irrespective of they're for-profit or not. The next slide, please. So you can just keep going. These are some of the cities we're working in currently. Some of the spaces I mentioned. You can go to the next slide. And then I just wanted to highlight that a significant study has been done in this state already by the RAND Institute, and it highlights that there is a significant shortage of psychiatric beds across the state, and that it's projected to worsen if not addressed. The two recommendations that they suggest is prioritize increasing psychiatric beds for that inpatient, but also for those community residential levels of care, which is known as supportive housing at times. They also suggest that we build capacity to serve the hard-to-place populations, such as those experiencing homelessness and those who might be connected to the criminal justice system. Next slide. No surprise here, but if you did a Google search, you would see hospitals across the country closing their psych beds. And that's not because the need isn't there. That's because the fiscal realities of managing psych patients are a challenge for hospitals, as I mentioned earlier. Next slide. Here's something, and if you remember one thing that I say today, I want you to remember this, that currently, sadly, across the country, 22% of adolescents have seriously considered attempting suicide. That's a number that should give us all great pause. I live in Colorado, and those Western states are considered the suicide belt, where they're higher than average rates of suicide in those places. We live in an era now where videos on TikTok and other places have kids showing how to secretly cut themselves and hide it from their parents. So I think I'm happy that this group is seeking to work in this space, because history has its eyes on us. They will look back at this time and say, what did we do? And the answer that we were waiting for someone else to fix it won't be an acceptable answer to our kids and to the future. Next slide. Here's some specific data in Santa Monica. And you'll see throughout this presentation, I'll talk about national and I'll talk about local. So in Santa Monica, this is recent data, 39% of 11th grade students experience chronic sadness or hopelessness. 37% of 11th grade students report current alcohol or drug use. Next slide. So the city of Santa Monica, recognizing this was an issue, they hired our firm to do 3 different things in this space. 1, community engagement with some key stakeholder interviews. We are north of 80 key stakeholder interviews personally right now. They've also asked for us to go and do a series of community listening sessions to get more insight from the community. At the end of this report, the learnings from that community will be provided to the city of Santa Monica for their decision. In addition to that, we will be doing a strategy on feasibility assessment. What possibilities are there for a potential facility? What type of model should be in place? What's the cost of that? And where in place could it be? Next slide. So recently, I think 2 weeks ago, we did our series of community listening sessions. You'll see pictured there the mayor, city councilor, police chief and others. And I feel the hallmark of this work is bringing communities together to get their perspective. It's one thing for old people like me to think what's going to help the youth, but it's another thing to actually do a session with them. So we did sessions in the schools, Samo High and others, to get their perspective of what they're experiencing and to have that shape the plan. We were fortunate enough to have it's moderated by KTLA and Darren Horton. And I think it was well received and it happened at the Annenberg Beach House. We also, next slide, did 2 other locations. We did the Virginia Avenue Park. We also did a location at the Santa Monica Library, all trying to go to different zip codes in Santa Monica so we could get a robust understanding of the needs and what solutions work in different zip codes. Next slide. And in those different communities, I think it was important to have different issues discussed. So we had a diverse amount of speakers really understanding the unique needs of different communities, workforce needs of the different cultures. And we also had it translated in different languages. Next slide. So when you think of what's happening nationally, I think it's important to recognize that oftentimes this work really gets its impetus, sadly, based on tragedy. So the next slide will show that in the city of Clovis, New Mexico, where they had a shooting in the library, unfortunately, that killed a couple of librarians and wounded some kids, they decided to come back to that same location 2 years later, and go to the next slide that shows this. And they decided to bring the police department, fire departments, and others together and to work on this issue aggressively. They partnered with 5 counties and 3 cities. Together, they brought all their opioid settlement dollars together in order to build a facility. And because they put their monies together, the state gave them a $10 million grant with the earmark that they would get more in the future. And they are now going to build a behavioral health facility. And the stakes are high in this community because they are in a position where if you have a child who has a mental health issue, you sometimes have to drive 5 hours to get care, or take them outside of New Mexico to Lubbock or Amarillo, Texas, in order to get care. So parents are faced with a tough choice. Do I have my kids stay close to me and care for them, or do I take them out of state in hopes they can get better? Next slide. And interestingly enough, as I go through this, Dayton, Ohio, another Midwestern state, Google decided to come into that location with their affiliate Verily, and they partnered with Alexandria Real Estate Equities and others, and they built a state-of-the-art recovery campus in Dayton, Ohio. Why Dayton, Ohio? Because that's a location that has the highest number of substance use deaths in the country, because Montgomery County is a drug corridor where all 3 highways across the country hit. So you're seeing here that people across the country are looking at unique ways of doing this, some in private-public partnerships, some with outside industries, some with hospitals partnering with states and counties to do this work. Next slide. This 115 is pictures of some of the work that's been done in 115, attention to green space. You can go to the next slide. Right there in Colorado, and hospitals are partnering with counties in some of this space. The important thing to understand is when you're asking hospitals to do it right next door to their hospital, that's a challenge for them, as I indicated earlier. If you're willing to put it in a location maybe not so close to the hospital, so they don't feel like they're getting inordinate burden of people coming from around the state at times and around to their location, you're more likely to get them to be a partner, a clinical partner like. So that's what happened in Colorado, where UC Health, University of Colorado Health, partnered with Larimer County, and they were able to, in their case, pass a tax in order to fund this. So I show there's multiple ways to fund this type of work, and you're seeing things that happen across the country. Not that that would work necessarily here, but there are learnings for us in those different places that we might be able to bring to the work that's happening here. Next slide. There's just some images. I think the importance of a therapeutic landscape is starting to become more and more understood. The importance of light and green space and how that helps in the healing environment. Next slide. And lastly, I'll close with something. This is a press release that's just hot off the press, came out today, where New York State, Mount Sinai is partnering together with New York State for a state-of-the-art recovery campus at the cost of $140 million. So the work that we're doing in Santa Monica is going to come up with some kind of cost structure, some hopeful locations. And I think as you go down the path of deciding what you're going to do in this space, it might make sense to do it in a regional model so they can partner in a way that benefits the whole. So I'm going to close with a short video of some of the work that's been done recently in the event we held 2 weeks ago, and then I'll open it up for questions. It's 1 minute. I think the time has come not to leave an issue as important as behavioral health just to those in the healthcare arena, hospitals, and the health ecosystem, but more broadly to involve people in this room, and particularly the voices of underserved.
It was really cool to be in a space where those who don't work in healthcare are also interested in the same thing.
This is not just a box that's being checked. This is a real initiative that means a lot to this community.
I am excited to be here with city staff, with community leaders, with residents.
Practitioners, people that are from the private sector, the public sector, elected officials, our fire chief. I mean, everyone in Santa Monica is very interested in this.
The fact that we're committing time to this extremely important conversation, it's truly an honor just to be in the room.
All of us need to be trained on what to do, what to say in those critical moments, because they can save lives. We all can save lives.
I think it is absolutely imperative and critical that we approach this work holistically and in a very deep way.
Talking is the first step in changing anything. I'm hopeful that we'll have a system that deals with the many mental health issues that face our society.
It's in these moments of crisis that we have a new opportunity, and we should all lean in as a community with new solutions and leverage new dollars to do new things. And that's what this conference is about, how you can have a future behavioral health by leveraging behavioral health education.
We're just getting started, and I'm just excited about where this process is going to lead us.
So with that, I open it up for questions.
That's great. First, is there anybody in the audience that has a question? Okay. Anybody in the chamber? Anybody on the COG? Good. Good.
Yeah, I was curious if it's possible to get a little more detail on your cooperation with the city of Santa Monica, how that worked out, and if it's still ongoing or if it was sort of a end to it. And
No, it's ongoing.
Yeah, and a final report will be delivered in both a video component and a written component by the end of the year. It'll have the findings from surveys that we're ongoing right now. We'll have a robust amount of both qualitative and quantitative data. We'll turn that over to the city of Santa Monica, and they will make a decision based on that.
are you going to be willing to share that with the COG, you think?
Yes, of course. This is really exciting work, a huge need in our community. And, we see it on our streets. We see the problem on our streets. We just don't see the solution on our streets. And that's where we try to close. We'll close that gap. And we definitely want to share our experience, with the region, because I think we'll be looking at the best practices for our city and for the region as well.
Yeah, that's great. Yeah, we have similar problems in our city. So yeah, I would be very interested. I think the whole COG is.
Yes, of course.
So are you interested in physical solutions or structural solutions? What at the end of the day, they're probably not going to build a new hospital, although I think UCLA opened a set of psych beds on the former Olympia Hospital. But where are you going with this? What's the end game here?
That's a great question. So I think there potentially could be a built environment solution, but that will take some time. That won't happen overnight. Until that day arrives, I think it's important to rethink current strategies. So for instance, in New Mexico, recognizing that many kids now don't want their parents to know they're suffering with substance use disorder, teachers are on the front lines. They're told more than physicians or parents that these issues are occurring, and they were ill-equipped to deal with it. So we worked with them closely. They were able to get a $2 million grant from HRSA, and now the pathways are easier for the students to go and get the information they need. So I think it's both strategic locations that need to be fixed, but also the built environment can't be left behind. As a physician, the ecosystem of healthcare is broken. The handoffs aren't connected. And in this space, because it's not paid well enough, the crisis care model begins to burden both the EMT and the police department in ways in which they have conflicts of obligation. They feel like they can't do their work. So my ultimate hope is that as Santa Monica goes down this path, it might make sense for the other cities in this group to partner so that we can look at it as both individual solutions, but also regional solutions.
You may or may not have heard, and Jeff could probably speak to this, but I heard Senator Portantino speaking today about a bill that would require 3/4 of the workers in a school environment to be trained in mental health evaluation, and it sort of addresses, that would be at the state level, but it sort of addresses part of what you're talking about.
Absolutely. I think at the state level, there's things to happen, but I think we all know you experience this on a local level. And good people are conflicted by this. While you want to help someone experiencing homelessness, at the same time, you're concerned about your child and how it impacts their care. So it's a complicated issue, but I think working in silos is not the solution, as we know.
To build a hospital of any sort would be a massive venture. Hospitals, depending on how they're constructed, are probably $2 or $3 million a room. Maybe a little bit less if you're not operating in them and things like that. But it would be an enormously expensive venture. And unless there's going to be funding from a federal source, probably, it's going to be very hard to create.
Yeah, so I think that currently there are kind of new models that are coming up. So certified behavioral health centers are things that are coming into place. It's a model that has a history of wanting to be in place since the 70s, that now are starting to come to prominence. There's also this notion of outpatient facilities that are a lot lower than building a psych hospital, crisis care facilities. Places like Arizona are creating diversion centers. So there are steps along the continuum that don't necessarily have to end up as a hospital, that are less cost effective and that can partner in ways in a hub and spoke model that might work. For instance, in Massachusetts, because of the shortage of child psychiatrists, and we know there's a shortage of workforce. I neglected to say earlier, this only works if you do it in a parallel track with educational facilities. So in Eastern New Mexico and Clovis College, they're training the next generation to actually support the built environment. But when you do it in places like Massachusetts, they've got a statewide hotline that allows you to connect child psychiatrists in ways that rural communities don't have. So I think a hub and spoke model that strengthens the existing ecosystem and looks towards a built environment that works is probably the solution.
And just the last thought, and we discussed this a little bit earlier. It's my view, mine alone at the moment, that if we treat mental illness as illness, if we treat mental illness the way we treat heart disease, it's got two parts to it. First is prevention. And we've done very little in the world of mental wellness or mental illness prevention. And that has to start early. That has to start in the early school years. And then the second part of illness is the cure for the ill. And we've done a little bit better with that. And so I would hope that when you're done, your program would address both sides of that equation. If we prevent the illness, then 20 years from now, we won't have this problem.
Absolutely. I think it's so important to get to people before they are in crisis. There's studies that show now social isolation is the equivalent of smoking 17 cigarettes a day. So that question of how you get to someone before they're exacerbated, people who have untreated mental illness have much higher cost of care for diabetes and other physical illness than those who don't. So the prevention side will save money long term. The challenge, as you all know, is whose pockets issue, who's going to pay for that prevention.
Yeah, just wanted to, it's very promising to hear other states and communities creating these facilities. And I know in the last discussion we had around the allocation around homelessness, it's very promising to hear a lot of comments made here in terms of collaborating to create that type of facility, regional behavioral health and wellness center. And so I think that's where we need to go. Los Angeles is really the epicenter of the mental health crisis in the country. If you really think about sort of the enormity of the problem that we have. So if other communities can do it, if there's, centers opening up in Dayton, Ohio, we have to be able to find the resources, because if not, we're incarcerating people. Twin Towers was, it probably still is the largest mental health, facility in the country. And so we're paying a lot of money already. The expense is already there, but it's through enforcement, not prevention and intervention. And so to the comment, Mr. Gold regarding, preventing sort of the crisis. And so in any case, I look forward to this discussion. We're going to share our results, and our example in Santa Monica with everyone here, so that we can get behind an initiative that we can all be proud of in helping people that really need help on our streets.
And thank you guys for taking the initiative to lead this. It's great. Thank you.
May I make a comment? I also thank you so much. This is incredible. And I think that at least in the city of West Hollywood, with our WeHo Care teams that will be coming online, it would be an interest, really a wonderful way for our 24/7 mobile behavioral health crisis response units to really have a space that we're looking for as well. Eventually, if this all pans together, it's all related. So I'm really excited about this as well.
Anybody else? Thank you, sir.
Thank you.
Okay, item number 7. What are we announcing? Oh, board announcements. Okay. Any announcements?
No announcements, but I just want to welcome you all to the city of West Hollywood, and we're really grateful to host all of you today here.
You? I will just say it's been my pleasure, my honor to chair this COG over the course of this last year. I really appreciate everybody's participation and help in keeping me on the straight and narrow. And I look forward with our new chair starting in August to work with you, Arden, to make that happen. So thank you. Thank you all.
Dr. Gold, it's been wonderful having you as chair, and I can't believe it went by so quickly, actually. Doesn't
Very
feel like
quick
it's been a year.
But thank you. Thank you. Somebody had their hand up. Is that what you're showing? No. Okay. Well, thank you. Thank you all. Future meetings. The next board meeting will be Thursday, August 10, 2023. It'll be in Beverly Hills. And then it says attendees. Are there any other public comments that we actually have not already heard, or on subjects that we've not? We do. Come, sir.
Thank you. Congratulations, new chair and outgoing chair. My name is Eric Rodriguez. I'm the LA County Government Affairs Officer for SCAG. Just wanted to quickly announce, thank you. And to the mayor, happy Pride for the city of West Hollywood. I was a former resident here of 8 years, but now I'm in the city of Culver City, but glad to be here, and I participated this past weekend. Just quickly, we have a new board chair for SCAG. He is Art Brown. He's a city councilman from the great city of Buena Park. So he'll be starting his chairmanship starting in July. So if you have any questions, feel free to reach out to me. Just quickly want to mention REAP 2.0 housing. We have a new application for infill on public lands for applications. It's the call for housing infill on public and private lands. We call it HIP. Applications are not open until July 10th. This is a competitive grant of over 8 million. And this is on affordable housing at scale on private and public lands, and also corridor wide and area wide regulatory infill housing actions. If you have any follow-up questions, you can reach me at Rodriguez, that's with a Z, and then last initial E, Rodriguez E at scag.ca.gov, and I'll hang around too if you have any questions.
Thank you very
Thank
much,
you.
sir. Great. Anybody else with any other announcements or comments? If not, I'll adjourn the meeting. Thank you all very much. Oh, and if you need to get validated, more important than anything, if you need your parking bill.
The parking validation is right outside the machine.
Okay. Thank you, sir. Okay, thank you all.
Thank you all.